Everyone. So I figured that we'd start out with part 1 and part 2 of the drugs notes. Please make sure that you've downloaded your guided note sheet so that you can follow along with me and fill in the notes that you need. I will warn you that the forensic drugs unit is a little content heavy, so please make sure that if you need to pause the video and go back and forth, please do that so that you can get every single piece of information. So the drugs unit is a fairly long unit, which is why I split it into two different parts. The first part is going to be classes and drugs. The second part is basically going to be the identification and the analysis side. Okay, so let's get started. If you wanted to get some more information from the book, okay, that's going to be in chapter 6 of the book. You guys should still have access to the online book. Hopefully you guys remember how to log in. I believe I left the login information on my main general page in Teams if you were a little confused about where to go, okay? All right, so let's get started with the introduction. What is the definition of a drug? A drug can be defined as a natural or synthetic substance that is used to produce physiological or psychological effects in humans or other higher order animals. When we talk about what a narcotic drug is, these are going to be analgesics, meaning that they're going to relieve pain, and they relieve pain by depressing our central nervous system. All of those things will affect all sorts of systems in the body. That's going to include our blood pressure, pulse rate, and then obviously our breathing rate. So there are 6 different classes of drugs. The first class is going to be narcotics. That's going to include the opioid family. Number 2 are going to be the hallucinogens. The third is going to be depressants. The fourth are going to be our class of stimulants. And then 5 will be the club drugs. And then the last one will be steroids, right? So what we're going to do, we're going to break them down individually so that we can get just an overall, let's say, overall view of what these drugs are all about and how they affect our bodies. Okay, so one thing I want to mention is the regular use of some sort of narcotic drug is going to lead to what we call physical dependency, which is definitely not a good thing. When we talk about what physical dependency on a drug means, is basically over time the body is going to develop a need for that drug, and it's going to be a need that you can't explain. Okay, you just want it. And if you were to stop using the drug abruptly, it will make you ill. Okay, essentially you're going to go through withdrawal. Okay, so the most common source for these narcotic drugs is going to be opium, and it's going to be extracted from poppies. Let's talk about all of the different types of drugs. So let's get into the opioids. So morphine is going to be extracted from opium, and that is actually used to synthesize heroin. Addicts frequently dissolve heroin in water by heating it in a spoon, and then they usually do some sort of injection. Heroin is going to produce a high that is accompanied with just extreme tiredness, but there's going to be a sense of well-being that's generally going to last for about 3 to 4 hours. The next opioid that I want to talk about is codeine. This is probably one that you guys have heard of. I'm sure you've heard of like cough medicine with codeine. Okay, it's also present in opium, but it's usually prepared synthetically from morphine. Oxycontin is another one that you've probably heard of. A lot of people take it for different medical injuries like knee pain and back pain. The active ingredient in Oxycontin is going to be oxycodone. Yo, these words are going to be crazy, this unit. They're not derived from opium or morphine, but it does have the same type of effects on the body as opium narcotics do. So there are other classes of opioids. Oxycontin is prescribed to 1 million patients for treatment of chronic pain. It's actually one of the most abused drugs in the world. Methadone is going to be another well-known synthetic opioid. I'm sure you guys have heard of methadone when we talk about methadone clinics. It's actually what they give heroin addicts to try and get them off of heroin. Okay, and the reason why it works is because the drug chemistry is extremely related, meaning it looks almost like heroin. So it has similar effects to heroin. So a lot of times they'll put them on methadone to try and wean them off of heroin, and then eventually they'll decrease the amount of methadone, and then they'll completely take them off of methadone. Okay, they're doing that so that they are minimizing all of the different side effects and the withdrawal effects from basically getting off of that drug. Okay, let's move on to the hallucinogens. Okay, when we talk about the most, I shouldn't say popular, but the most well-known is going to be marijuana. They basically are going to cause marked changes in our normal thought process, perceptions, and moods. They can affect all sorts of different systems in the body. Marijuana is one of the most controversial drugs in this class, just because we don't know what the long-term effects on health are. There are a lot of people that say there are a lot of benefits to marijuana, especially for people that have cancer and certain chronic issues. They say that marijuana helps with pain, it helps with a lot of depression and things like that. But we haven't really studied the effects on the body for long-term marijuana users. Okay, so when we talk about marijuana, marijuana is going to be made from the cannabis plant. The chemical substance that basically gives marijuana its high is known as THC. I'm sure you guys have heard of it. The THC content in cannabis is going to vary depending on the parts of the plant, and it's normally decreasing in the following sequence. So resin, flowers, leaf, and then there's a little bit of THC in the stem, roots, or seeds. Okay, when we talk about TH-rich resin, it is known as hashish. There are a few celebrities that have actually OD'd on hashish just because the level of THC is so high. It doesn't seem like marijuana causes physical dependency, but the risk of harm comes in those heavy long-term use. It's just like that with any drug. Okay, so this is the other class of hallucinogens. So we're talking about things like acid, so LSD, mescaline, PCP. MDMA is probably one that you guys have heard of. That's typically a club drug, okay, known as ecstasy. LSD is going to be synthesized from lysergic acid. It can cause hallucinations that can last for 12 hours. Some people have talked about highs lasting for days. So it's definitely going to depend on your own personal chemistry. And please, as we're going through this unit, please do not volunteer any information. I don't need to know about any of your extracurricular habits. Please keep that to yourself. When we talk about PCP, the reason why it's such a problem, first of all, it's PCP, right? But the other problem is that it is synthesized in all of these secret laboratories. In terms of PCP and how it's ingested, it's usually smoked or sniffed, or you can also eat it. Okay, so when we talk about this, right, it's often going to be mixed with other drugs such as LSD or amphetamines, and it's usually sold as a solid powder. You've probably heard about it on TV the typical name would be angel dust, and it's usually in a capsule or a tablet format. Oral take of PCP is going to lead to feelings of strength and invulnerability, okay? You feel like you are on top of the world and nobody can do anything to you. Unfortunately, the flip side of that is it definitely can turn that strength and invulnerability into depression, tendencies toward violence, and can also lead to suicides. There are some celebrities that definitely overdosed on PCP, and they had that strength. And you hear about people lifting up cars and things like that. That tends to happen when people are amped up on drugs or some sort of adrenaline factor. But then after, it leads to such a depressive state that they end up committing suicide. Okay, let's move on to depressants. So depressants are going to be another class of drugs. They do exactly what their name says. They depress the function of the central nervous system, okay? Basically, they are decreasing the firing of our central nervous system, which leads us to, let's just say, slower movements, slurred speech, things like that. Depressants can calm irritability and anxiety, and it may cause you to go to sleep. So things like barbiturates are prescribed to people that have problems going to sleep or that are anxious by obviously licensed doctors. The list is going to include, the list is pretty long, okay, and it contains some interesting, let's just say, players. Okay, so we have alcohol, and we're talking about the ethanol side of alcohol. We're not talking about the methanol side of alcohol. Hopefully, when you guys get of age and you decide that you want to have a drink, if you want to, please make sure that you are ingesting ethanol, not methanol. You ingest methanol, it could kill you. One drink could kill you. Okay. Then we have the barbiturates, which are basically the sleeping pills. We have tranquilizers. Those are things like Valium. But then there are also some random substances that can be sniffed, such as airplane glue, model cement. We have the aerosol can propellants, such as Freon. I don't know if you guys have watched, what is that show? My Strange Addiction. There are people that are addicted to sniffing, the keyboard cleaners that you buy in the store. There are some people that are addicted to huffing, those types of things. When we talk about alcohol, which is probably the biggest member of the depressant family, it's going to enter the body's bloodstream really quickly, and it's going to travel to the brain, and it's going to start to suppress basically your brain's control of your body. Okay, that's why a lot of people that get probably extremely drunk, they have issues walking. Sometimes because their thought processes are all jumbled. They have issues speaking, and they tend to slur their speech and things like that. But that's because alcohol is basically depressing your brain's control center. Okay, when we talk about barbiturates or downers, they're normally taken orally in pill form. They usually create some sort of feeling of well-being. They're going to relax the body, and they usually make you go to sleep. So a lot of doctors will prescribe them if you're having issues going to sleep. Just to facilitate that process so you can get some sleep. And then we have tranquilizers. So unlike barbiturates, tranquilizers are going to produce this relaxing tranquility, but it does not, for most people, impair their high thinking faculties or inducing sleep. You'll hear a lot of people that get nervous on planes, and they'll decide that they need a tranquilizer, and they may take a Valium maybe to calm themselves down so that they're not, climbing the walls while they're in the plane. When we talk about the hodgepodge of depressants, when we call it sniffing, it's going to have immediate effects, meaning you're going to have the exhilaration. The flip side of that is because there's so many unknown items or chemicals in those products, they're also going to affect major organs in the body. So we're talking about the liver, the heart, could cause permanent brain damage, or we're even talking about death, depending on what it is that you were sniffing or huffing and how often you were doing it. Okay, let's move on to the next class, which is going to be the stimulants. So the drug classification of stimulants is going to include the amphetamines, sometimes known as uppers on the street, or speed. Cocaine is going to be in that group. And then we have the freebase form, which is is going to be known as crack. Stimulants are going to be substances that are taken to increase alertness or activity. Normally, that's followed by a decrease in fatigue, and then you have a loss of appetite. Okay, so a lot of, I know back in the day for, was it the Air Force pilots? They were actually prescribed stimulants so that they could fly and be alert during drills, but then also during wars when they actually had to fly the planes and drop bombs. There are two different versions of amphetamines. We have amphetamines and we have methamphetamines. They are often injected intravenously, and they usually cause some sort of rush that's followed by an intense feeling of pleasure. But it's also followed by a period of exhaustion, and also there is a prolonged period of depression that comes almost directly after that. When we talk about cocaine, it's extracted from the leaves of the coca plant. It is going to increase alertness and vigor. It is going to suppress hunger. It's going to suppress your fatigue or your tiredness, and it has a tendency to suppress boredom. I'm going to show you guys a video at some point of, it was a video on how they actually process cocaine. If anybody watches that video, I don't even know why they would think about taking cocaine. Okay, when we talk about crack, crack is going to be cocaine mixed with some extras. Okay, so it's going to have baking soda, and then it's going to have water in there, and then it's going to be heated. Typically, crack can be smoked. It's going to stimulate the brain's pleasure center, just like cocaine does. It is an extremely addictive drug. Okay, let's get into the bigger category, and that's going to be club drugs. There are a few drugs that fit into this category. Unfortunately, most of them are synthetic, which means that they are made in these, hidden labs, and they're usually cut with all sorts of nasty things. But typically they're called club drugs because they're used at nightclubs, bars, and raves. I figure most of you know what raves are, but I figured I'd put that in there, that they're all-night dance parties. Substances that are often used as club drugs, we're talking about MDMA, known as ecstasy, GHB, which is basically Rohypnol. They fall into the same category of roofies, ketamine, and then methamphetamine. Ketamine is pretty much used for vets, but it has been known to have been abused by humans to get this high at a club. Okay. GHB and Rohypnol, also known as roofies, are usually ingested unaware, right? You're at a club or you're at a bar, you walk away from your drink, somebody slips you something and puts it in your drink because they want to, I don't know, kidnap you or whatever it is, okay? So that's usually where GHB and Rohypnol comes into play. They're usually not something that you're like, whoa, I'm going to take some Rohypnol when I go to the club, okay? It's usually for nefarious purposes. Okay, so when we talk about GHB and Rohypnol, they're going to be central nervous system depressants, and they're often connected, like I said, with nefarious deeds, drug-facilitated sexual assault, rape, and robbery. The bad thing about GHB is that, and Rohypnol, is that they leave your body so fast that sometimes you may not even know that you were roofied. Okay, when we talk about MDMA, it is going to be a synthetic mind-altering drug that's going to exhibit many hallucinogenic and amphetamine-like effects. Ecstasy is going to enhance self-awareness and decreases inhibitions. People say that when they're on ecstasy, they can feel the air, right? Everything just feels a little bit more heightened. The downside of that is you can potentially, on the other side, get seizures, muscle breakdowns, you can have a stroke, kidney failure, you can have issues with your heart, so your cardiovascular system can fail. This is usually comes after chronic abuse. Okay, when we talk about ketamine, like I was saying before, it's primarily used by veterinarians. It's usually an animal anesthetic, but humans do abuse it, and it causes euphoria, which is basically happiness, and hallucinations. Ketamine can also impair motor functions. It can give you high blood pressure. You can get amnesia. And I've heard of people having blocks of amnesia that last up to months, where they lose a month of time. And you can also have a mild respiratory depression, meaning that you're having issues breathing. Okay, that last category is going to be anabolic steroids. These are going to be synthetic compounds that are chemically related to the male sex hormone, testosterone. Basically, anabolic steroids, this is where they get the name roids. Like if you want to get swole in the gym, some people decide that the best route is the cheapest route, and that is to take roids. Anabolic steroids are going to be abused by those that are trying to accelerate muscle growth. Usually it happens in a lot of, I shouldn't say a lot, a fair amount of, sports players, athletes, right, that are trying to increase their muscle mass. Some of the side effects, they're definitely more on the personality and mood side. You're going to have, there are some people that say they get really, really angry. There are some people that say they just get crazy depressed. You're going to have a diminished sex drive. Your bones are going to stop growing, and you can potentially get liver cancer. And that has to do with the way that your body breaks down all of the drugs is through your liver. So if at any point your liver, let's just say, is working overtime, it could potentially result in cancer of that particular organ. In this case, it's going to be the liver. Okay, that is the end of part 1. So hopefully you learned some information. The next part of the presentation is going to be the part 2, and you will see that in the next video.